Hey everyone, Wausau Mayor Katie Rosenberg here with my partner in crime and information, Marathon County Health Educator Laura Scudiere slash almost into a new position, but we got over that. And then we have a special guest, the amazing, the beautiful, the radiant, the smart Mang Xiong from H2N.
Yes.
How are you?
Hi, I'm doing well. How are you two doing?
Great. We're super excited to have you on today.
So excited.
Yes, me too.
Okay, so I'm just going to launch into our series of questions because my first question, I think, is a question everyone's going to ask. What the heck is H2N?
So H2N was created last year just by, it's a collaboration between community partners because they, we know that there's a need within our underserved populations here. We knew that this also um, was present before the pandemic, but it was really elevated and compounded with the pandemic. And so we're just a group of collaborators that are really passionate about strengthening communication channels and facilitating regular information exchange between our public health systems and resource agencies. So we're really just a connector of resources.
Yeah, it's
Amazing.
Awesome.
We needed that. Yeah.
We did. So tell us a little bit about what H2N is up to.
Yeah, so we've done a lot. So last year we really focused on, and this year too, we focus on COVID education. And so again, letting people know, the weekly updates that are happening, right? Like we shouldn't pay attention to what happened last week because this week it's completely different. And sometimes a lot of our underserved communities have a really hard time keeping up with it. I mean, I do too. I think you all do too, because we all wear a lot of different hats and, there's a lot going on every day anyways, but really helping make sure that everybody is aware of important updates that come out, and then also providing vaccination opportunities as well. So last year we did a couple flu clinics here in Marathon County, as well as Wood and Portage County. So that was really cool. And then of course, with the vaccine that rolled out this year for COVID, we helped with that education piece. We also helped our partners with some interpretation of, again, education flyers, pamphlets, brochures. And then now we're really focusing on helping do some pop-up clinics. Again, for us, what we found through this project is that the way you say things and where and how you say these things to our community members really matter. So for me, like I say, people and process, right? People and process matter, and you have to be intentional. It has to be coming from a trusted messenger, and also we have to go where the people are. Again, there are so many different barriers that our communities face. That's language, literacy, transportation, access, and also trust, right? Trust within the different systems that we live in. And so we try to break down those barriers as much as we can. And of course, it's not just about breaking those down, but also making sure that we can connect our community members to the resources, again, through a trusted messenger, and start building those relationships. And so through everything that we do, that's really our goal. And so, yeah, again, we're doing some pop-up clinics at the Hmong American Center, who has just been an amazing partner and collaborator in this project. And then our biggest one that we've done is at the Greenheck Fieldhouse. So again, shout out to DC Everest. Obviously, they have amazing leadership there as well. And so you can check us out on our Facebook page too. We have a lot of updates on there. And again, the other part of me, the other side of this project are our Hispanic community coordinators, and they've done a rock star job as well. And so we try to post as much as we can on our social media outlets. We also have a YouTube channel in case you guys want to watch some videos that we've done. I also do a weekly podcast every Wednesday from 5:30 to 6, sometimes late, longer than that, depending on how talkative I'm feeling, which, as you can tell, I'm a talker. So sometimes I go later than that. But our weekly podcast, again, I do the updates. Sometimes I have a guest speaker on just to talk about anything and everything. Again, right now, during the pandemic, we see that basic needs are, vitally important, and a lot of people have lost resources, and so we need to make sure that we're able to connect them as much as possible, or that at least they're aware, right, of the resources that are available right now. And so, yeah, that's really high level kind of overview of everything that we do. Our project has grown a lot and we do a lot of other things, but that's the majority of it.
Yeah, H2N has really been like the MVP of getting to, the underserved populations and populations that have not classically been highlighted by
Yes.
kind of traditional public health means. And and the Greenheck Field House site was, I was wildly successful. Like I was super pleased with the turnout there.
Yeah, especially with our younger folks, 12 plus being able to be vaccinated. We had half of the folks that came through were walk-ins, and it was a very diverse clinic. Just because we're H2N doesn't mean you have to be Hmong or Hispanic to come to anything that we do. All of our events are open to the public. And again, it's not just about the Hmong and Hispanic people, it's for everybody, and so we were really happy to see that clinic be really successful. And some people came in groups of like 6 and 8 people because the whole families wanted to wait to get vaccinated together. And I felt like that within itself also was super empowering and inspiring to me, because they were helping educate their kids, and saying, hey, we can do this together. This is, what we should do. We want to protect ourselves and our friends and our families, right? And so that was really cool. One other thing that we did that was new to that clinic was that we added a social media station. And so we asked people, who were comfortable with sharing why they got vaccinated. And people shared, hey, I want to hang out with my friends. I want to protect my loved ones. I don't want to have to wear a mask around my friends who are also vaccinated, right? And so again, there were so many different reasons, and we were really excited to see those. And so we'll be posting those on our social media channels as well. So yeah,
I just dove in and found you, and I love that. I love that so much. And your posters are in 3 languages, and I just love it. Also, I hope family of 6 that got vaccinated together on their 2nd dose knows what they want to watch on Netflix together when they're maybe resting and feeling a little tired.
Oh man, everyone is so, kids are more tech savvy than we are. Even my son, who is like 19 months now, his first year was in quarantine. And so he got tech savvy a lot faster than my daughter did, who's now 3.5. So I'm like, oh man, it's that's the world we live in, but that's okay. Yeah, no, it was amazing to see. And, I think it was like the 12-year-old through like grandma who came together. So that was really cool to get vaccinated.
That is awesome.
Yeah. I saw some fun signs from people because they were holding up signs, and some of them made me laugh out loud because they were very truthful.
Mom made me.
Mom made me do it. Yeah.
My mom made me do it.
That is a good mom. I would be that mom too.
Yeah. We need those moms out there to, tell their kids why they need to get vaccinated. Because, as you both know, kids 12 plus can get vaccinated if they go and get a Pfizer vaccine. In order to do that, they just go to vaccinefinder.org. We also highlight on the Marathon County Health Department website, we try to highlight all of H2N's events. So you can find that on our Facebook too, and our website, because we want them to be successful. They do an amazing job. So we're partnered with them to make sure that everybody gets a vaccination if they want one.
Yes. Yay. And thank you so much to our health department and all of our partners. So we do have, WIPS, Dr. Corey Norbaum, and
oh my gosh, why haven't we had her on here yet?
Julie Bunchak. These are our core team rock stars that made this happen. And, we are partnered with United Way, Aspirus, Marshville Clinic, Bridge Clinic, of course, our awesome health department, and so many other organizations. Again, the Hmong American Center. We have so many great partners in this. And so know that it's not just us, but I think too, COVID has really brought to the forefront that we have to work together, right? If we don't work together, we're never going to be successful in overcoming COVID-19. And so I hope that, I hope that everyone is aware of that. And again, just not just for COVID-19 though, right? I think it's really just going forward. Like, this is why we need to really create a streamlined system and connecting resources and working together and doing those really good referrals. Like, that's what we're all about too. And for us, it wasn't about stepping on anyone's toes or taking anything away from anybody. It's just about holding hands, doing this together, adding capacity to everybody, right? And so again, that's really our goal. And so here we are a year and a half later, still doing the work that we're doing. It's really crazy, but it has been such a humbling project for me, and now it's a passion project, and I'm just really happy that I can be a part of the team and be a part of all of the great work that every single organization is doing. So,
oh man, I feel inspired. I'm excited when we're out of this pandemic, what you're going to focus on next, because I mean, there's so much good to be done, so
There
much
is.
community to build.
Yes, definitely. Well, it
Oh.
helps that I have great leaders like you two as well, too, that I can look up to and also rely on. So thank you to both of you for being there for us through this whole journey too.
Well, I think it's, you know, the thing that keeps popping up for me as public health is that, you know, COVID has taken all of our brain space for the last year, but there are still health disparities out there that haven't gotten better during COVID. So, you know, I'm sure that there's going to be a lot of work that we're going to need H2N's partnership in, because very basic things, very basic needs, you know, we need appropriate nutrition and opportunities for new mothers. We need, you know, smoking cessation. There's a million things I could go on and on, because I'm totally a public health nerd, which
You are
if you
kind
didn't
of
know
that
that
way.
already. But you know that those things didn't get any better, and so we're you know, we're keeping our fingers crossed to see how bad they got. Mental health
Oh my
this
gosh,
past
mental
year.
health.
Oh
Yeah,
man.
and I do want to say too that again, through this project, we did start a Hmong community talks that we do monthly. In May, we really focused on debunking the myth about fertility in women and the vaccine, because again, that kept coming up. And again, culturally,
Yeah.
the Hmong community is very superstitious, and that has been a huge concern that kept coming up over and over again. So we do try to pay attention to trends, or how we can debunk these myths with practical and also very reliable you know, studies and information. We make sure that all of the information that we share is vetted as well. That's really important about the credibility, right, of where this information came from. Is it coming from a government website, or is it a fake website that somebody tried to make look like a government website, right? And so it's these things, and kind of again re-educating our communities at different touch points to make sure that they are truly understanding the studies that go behind, you know, the vaccine creation, and who should and shouldn't get it or whatever, or if you have a health concern, consulting with your doctor first, these types of things. We make those same referrals as well to folks that are coming to our clinics, and also just asking us questions when we are, you know, doing our outreach to the community. And so we try to do the best that we can to keep up with all of this information. But again, if you guys follow us on our H2N Facebook page, we will be having those monthly. And we'll be also incorporating other different types of monthly educational, like lunch and learns, that's coming up as well. So there's just a plethora of information that we know that the community needs. And so we will try our best to, again, keep up and provide those in a fun and friendly manner. Too boring, because we're all kind of nerds in some ways, right? And so I love having discussions like this too. So we could talk forever in a day, I'm sure, about this, but we'll try to keep it as short and succinct as possible. And it's about also, sharing the information in a way that our audience can also understand, right? Again, that's really important. Sometimes things that come out might be a little bit too technical, and so folks may have a hard time really understanding what the true message is. And so we try also working with our partners on that, and just for, you know, internal things that we've been putting out. Again, we are not experts by any means on anything, but again, we are just really here to help relay the information. So
awesome. Yeah, well, we'd love to have you back to talk about, you know, the top 3 things that you're hearing out in the community, and how you know, like I know for a fact that the CDC has not found any link between infertility and the COVID vaccine. And so we'd love to have you back on to kind of talk about that stuff, if you'd be willing.
Yeah, for sure. I would love to come back.
Did we get where we find you more information? Facebook? What else? Where else do we go for H2N?
So our Facebook page is called H2N Community Announcements. We also have a YouTube channel called H2N Community Announcements. You can reach us at our email, which is h2n.chw@gmail.com. or our phone number, which is 715-680-9563. And so you'll get my voice. Okay, I'm in charge of that phone. So if you don't want to talk to me, don't call. Okay. Just kidding. But
we just want to chat.
Just if you want to chat, that's cool too. Okay. I'm always here. I'm a chatter. We could chat any time of the day. So so that's where you guys can find us. And we're hoping to also add other channels to us. So yeah.
So pretty soon we'll have an H2N TikTok channel to follow. And
oh my gosh.
Oh,
that's a surprise. I can't say anything yet. That's a surprise. Maybe.
Oh, sorry. I'm excited.
Spoiler alert.
Yay.
Okay. Well, let us know if you want to do a dance, because I used to be in show choir. Jazz hands. That was a jazz hands. So, yep. Oh, I
was a dancer. So that's really funny.
Oh, yeah.
I love it.
I wouldn't say I was a dancer. I would say that they took pity on me and put me in the back row of my show choir. So it would be interesting, to say the least.
Okay, well. I think that if us three did a TikTok together, that'd be amazing. And let's make it happen soon.
Okay.
I love it.
We're doing it.
Okay. All right.
No when. We're doing it though.
Thanks, ladies, and we'll see you next week.